Hello, people. I'm not used to doing this kind of thing, so bear with me. This will not be a professional production by any stretch of the imagination. I'm no Walt Disney. My name is Alwyn, and I have my partner of 45 years is Eugene. And what I want to do in this video, there'll be other videos to follow with, audio and videos to back up what I'm saying here. But what's important for me in this introductory video is to point out the dangers of going abroad with companies under the cross-border directive, the EU directive of 2411 or something like that, where patients can go usually to Spain and other countries to get operations done. Now, the companies would be Surgery Now, Healthcare Abroad, there's other ones as well. And I have no knowledge of how the other companies operate. The only company I have deep knowledge on is Healthcare Abroad with Mr. Chris Goody at the helm. So the first thing I'd like to say, and I don't care if this proves to be an endorsement of Mr. Goody's company, they filled in a gap in services in Irish hospital that should not exist, for starters. So people going out with hips, knees, and investigative surgeries like diagnostic endoscopies, lenses removed for your eyes and replaced, colposcopies, all that kind of thing, knee replacements, hip replacements are all fantastic, just fantastic, and they should be continued. And to be honest, it's a reflection on the ridiculous situation in the HSE that we can't do this in Ireland, but we can't, not to the extent. And over with Healthcare Abroad, you get a mini holiday because you're in a hotel and you get a discounted rate for that. The food is good, you can get fed up with the food eventually, but the food is good and it's included. And I think the package is something like 110 a night for your food, your breakfast and your dinner. And you also get transport to the hospital, between the hospital and the hotel. And I have to say also that the drivers are the nicest people you could ever meet. So you've Suzanne, you've Tony, you've James, you've Kevin, you've Joe, Vincenzo from Switzerland. The best people you could ever meet. So from the perspective of having an operation done that's low risk, absolutely perfect. Go on, hop on the plane, get there and get the job done. Combined with a mini holiday, I can't fault it. But in my situation, the operation they're doing in HCB Denia called an esophagectomy needs to be shut down, because when it goes wrong, you get abandoned. So the situation is, Eugene, my darling Eugene, went out on the 7th of May. Beautiful, beautiful man, hilarious sense of humour. Just a joy to be with, and every minute, even when he's quiet, he's just entertaining. He's just that type of person. He's just really a special type of person, very, very popular because everybody just enjoys having fun with him, So he went out actually in April, and he had, I guess, an endoscopy done, during which a stage 1 and early T1B esophageal cancer was diagnosed, and that was a very, very good thing to do. Very, very definitely, like anybody who's got symptoms should hop on a plane and go out there and have Dr. Alberola do that diagnostic test. Absolutely. But then things hit the fan immediately after that. Eugene was described the operation in a manner that just didn't pan out at all. Then he described it to me, and it didn't sound like a huge operation. Like, you have to go into intensive care for 2 or 3 days, 4 days maybe, and then you're released for 4 days, and then you can fly home after 10 or 11 days, something like that, So now I thought it's only a tiny cancer, so they'll only, like a bowel resection, which Eugene has had, they just take a couple of inches around that area, and that's it, you're home and dry. And again, you're in intensive care, and of course it's difficult. Obviously it's a difficult operation, but it's it's doable. With this operation for a cancer that we were told was the size of a wart, basically half a centimetre to a centimetre, which is not true, I believe. They cut off the top of your stomach, or maybe they don't. In some operations, they cut the top of your stomach off and they pull your stomach up. They take out 25 centimetres, which is what the doctor said to me they did with Eugene. They took out 25 centimetres. And so here at the Carina, they tie the remnants of your esophagus to the top of your bloody stomach. It's a crazy operation for a small tumour for a stage 1, but that is the standard, the gold standard. That's what these doctors do. Now, we weren't told that, of course, otherwise I'd have gone out with them, or actually, more to the point, we'd have had the operation done at home. So Eugene goes out and gets his operation. I called Chris Goody because I had told Chris Goody numerous times, please don't let him get cold in ICU because he's COPD, and if that chest gets infected, he starts to cough, and that has to be critical for new thoracic sutures, you know. And of course, Chris said, oh, ICU was warm, and did absolutely nothing. So Eugene WhatsApped me and said, I think I'm dying, Alwyn. I'm freezing cold here, and they've left me freezing cold, and they do nothing for me in ICU. They don't care. So I immediately got onto Healthcare Abroad, and Mr. Goody supplied Eugene with a blanket that night, but too little too late. Eugene already had a chest infection. So that's not good, but still Eugene was pulling through. He was doing okay. Then the plan was for me to fly out on the 13th of May and for me to take him home, the two of us together, on the 17th. So this is according to what Eugene was told. We did that, we booked it. And so I flew out on the 13th, and when I was on the tarmac at Dublin Airport, got a WhatsApp from Eugene, Alwyn, I'm dying. I can't breathe. Couldn't understand a word he said because he couldn't breathe. I'm worried sick, and I have to be 5 hours in transport between the plane, the airport, getting picked up by transport, getting to the hospital at HCB Denia. And I walk into room 212, or 213, I think it was 2, it doesn't matter. And I find Eugene gasping for air, leaning over a trolley. And he told me he had been gasping for air all that day. I couldn't believe my eyes. 3 nurses are sitting on their arses at the nurses' station, which is directly opposite Eugene's room. Eugene can't breathe. He can't lie down. He can't sit straight. He's leaning over the hospital trolley, naked, almost naked, gasping for air, with a chest drain attached to him. So I was a physio years ago. I couldn't believe it. So I said to the nurses, will you please call a doctor? Like, God, I was thinking to myself, this is just, it got to be like something out of the Twilight Zone at that point. And at that point, I determined I was going to document everything any way I could without being too obvious and obnoxious, you know. Document everything I could about Eugene's treatment for justice for Eugene if things don't go right, and also to highlight with the HSE what they are sanctioning abroad. Another thing now before I move on. It was put to us by Mr. Goody that Eugene would certainly die in Ireland if he didn't have the operation abroad, that the HSE would never get around to operating on Eugene. So in fact, Eugene's cancer was held as a form of ransom, that if he didn't have his operation there in HCB, he would certainly die if he went home. Now, we don't have access to audits of the HSE, but looking back, I was thinking, I think the HSE are actually quite good when there is a cancer diagnosis. I think they don't leave an inordinate amount of time. So we were sort of fed a line of bullshit. Excuse the French. Anyway, so Eugene's there gasping for air. This is the 13th, the night of the 13th. And so I can't leave the hospital, you know, and they have a sofa bed. So I stay the night with Eugene. I look, because I can tell if there's air entry or not. There's no air entry on the right-hand side at all. His chest drain is there. There's no fluctuation in the tube. And there's no air entry on the right. So I asked the nurses, can you get somebody quick? I asked for a respiratory consultant on a couple of occasions. I don't think they even knew what a respiratory consultant was. So this man, Clement Luigi, a doctor, comes in from the emergency room. And to cut a long story short, he walks in and says to Eugene, I'm here to help you. He didn't check the chest drain, which had blocked. It's on x-ray. The previous day, May the 12th, in the morning, 10 o'clock, 20 past 10 in the morning, the chest drain was already blocked in 2 places and nothing had been done. No alarm was raised. It's just unbelievable that the nurses wouldn't do something about it, to say nothing of the doctors. Like, there were good ICU doctors in that hospital. They weren't even informed. I didn't know the system. I had asked the nurses to get a doctor. So he strolls in, doesn't examine Eugene's chest properly at all. He says to me, well, I'm not familiar with his history. So I start to tell him his history, and then he starts shouting at me for interrupting him. I'm just trying to give him Eugene's history. It's crazy. So I ask him on 4 occasions, 2 of which I can prove, that please get him a respiratory consult. No, talk to his doctor in the morning. Oh my God, talk to his doctor in the morning. So Eugene is left till his doctor, Alberola, came in around 11 o'clock the next morning. We're into the 14th. Eugene has been left with a blocked chest drain for at least 50 hours at this stage, gasping for air. And Eugene has never been right since. I got him a chalk ice, because there's most of the time he's not allowed to eat or drink, but at this stage he was allowed to eat something soft, like ice cream or whatever. So got him a chalk ice. And at this stage, the hospital are trying to blame me. Their difficulty was that I was noticing things. They had great difficulty with that. So they were trying to turn the tables on me, including Mr. Goody of Healthcare Abroad. The tables, the wagons circled around me, and I was the problem, quote unquote. And I was in the room when chest drain stopped working. Yeah. So anyway, where was I? The doc comes in. They all said, oh, wait for the doctor to come in. So 50 hours later, Eugene's gasping for air all this time. So by the time the doctor cleared the chest drain, I had given Eugene the chalk ice. I was bullied at this stage by the doctor and by Chris Goody and everybody. Not everybody, now I can't say that, but I was bullied. I was told there was physio notes and nursing notes, and they were all complaints about me. Yeah, of course, this turned out not to be true, but I didn't know that at the time. I'm deeply traumatized watching Eugene dying. So I watch brown fluid come out the chest drain, and as a physio, I'm thinking to myself, it's not natural. Like, if it's stale blood, there should be a reddish tinge to it. With Billy Rubin, there should be a reddish tinge. There's no reddish tinge, it was the feckin' chalk ice coming straight out the tube. This is the 14th of May. They should have been observing this. No, they didn't observe what was coming out the chest drain at all. The next thing I noticed was a pneumothorax, it's called, and it's a sign of a leaking anastomosis. A leaking anastomosis is where the operation site breaks down. It's often fatal. So they never checked for a leaking anastomosis, even though it's the most lethal complication you can have with the operation Eugene had. No, never checked it. So around this time, the leaking anastomosis coincides with the blocked chest drain because Eugene's gasping for air and trying to cough, and the whole intrathoracic pressures change and ruptured his site, his operation site. That's what happened, because it's all in the same time frame. Of course, that'll be denied. So I better just get to the chase, okay? Eugene's moved back to ICU. He didn't want to go back because I can't be with him when he goes back. He didn't trust them. He'll end up getting cold again. Oh, look, I will cut to the chase because it's just been hell. Just been absolute hell. Eugene has been left permanently damaged at this stage. He had to have chest drains in. There's a pocket of pus in his mediastinum, which is the area, it's like a little bag under your heart. There's a pocket of pus in there that is still there to this day. That is still, to my mind, life-threatening. He's on intravenous antibiotics, and whenever they take him off these antibiotics, they turfed him out to a hospital 3 days ago or 4 days ago. And at this stage, his brother and sister are over with him. I was out with him for over 2 months. So I came home just under 2 weeks ago. So they turfed him out, and then they had to readmit him for hospital-acquired pneumonia. Now, he wasn't in any other hospital. He's not able to move. He's doubly incontinent. He can't think straight. He's completely confused. He can't eat. He can't stand. They let him develop a vitamin B deficiency as well. That's not in any of the medical notes. I'll cut a long story short. Do not allow yourself to have an esophagectomy in HCB Denia. Do not allow yourself, with any of the cross-border directive people, to be shipped over for a serious operation with high risk of complications, because you will be dropped by the HSE, you will be dropped by Chris Goody. They don't want to organise repatriation. This is going on since May. It's still going on. We're trying to repatriate him. But the spiel now is, oh, he's not fit to be moved. Like, they can move people on a ventilator, but they can't move Eugene. So Eugene is stuck in that hospital because he was turfed out to the hotel, and he was close to the 3-month limit for public funding. His people are being approached every second day. Rosemary and Cahill are being approached every 2 days by someone chasing them around with one of those little payment machines. They're looking for 3,000 every 2 days to keep Eugene in for a botched surgery, botched aftercare. The surgery itself wasn't botched, but the aftercare botched the surgery, and a hospital-acquired pneumonia. The HSE won't tell me who's responsible for bringing him home. It's under an EU cross-border directive. It's public funding. But they're actually leaving people, and this could happen to anyone. They're leaving people abroad in critical situations with no way home. Now, Eugene's nephew has set up a GoFundMe page, so financially we should be okay. But will the hospital sign off and let Eugene be transported home? Since May, they say, oh yeah, he'll be ready next week. He'll be ready next week. Can't believe a word they say. Then, oh no, he's not fit to go. So I booked a ferry, and I booked 4 flights. And because he's over 70, travel insurance won't cover the loss. And of course, the doctor in HCB denied that he told me Eugene would be fit to travel by ferry. He would, and he did, but he's denying that. So there's things in travel insurance also, pre-existing condition, because he had been diagnosed with the cancer prior to his surgery, even though the complication rate is 20% for that type of complication. That's far too high. Nobody should go abroad. So at the moment, we're stuck between the HSE, don't particularly want to know, the embassy, get in touch with the HSE, who don't particularly want to know. We have to get an admission bed in Beaumont, preferably, because it's easier to get parking at Beaumont. And the matter, if we can manage to get him home at all. So at the moment, that's what we're trying to do. That's crazy as well. The girl in Beaumont was helpful on the phone, but she said she couldn't give me a number for bed management. She couldn't give me a number for anyone to contact with regard to that. It had to be consultant to consultant. So the consultant in Denia has to contact the consultant in Beaumont, and then they see if they have a bed. The matter, it's a slightly different arrangement. It's a man called Liam Winters, and we've been in touch with him. And at this stage, we can't be fussy. Beggars can't be choosers. The latest is the doctor in Denia, they're being advised by lawyers, I'm sure, at this stage. At the moment, they're refusing to let Eugene go. So where does that leave us? So I leave you with those thoughts. if you go with healthcare abroad, I can't speak for other companies, and you have an esophagectomy, come home after you're diagnosed. Go out, get your diagnosis. Absolutely go out and get your diagnosis. And then go on social media to have your operation done. Because I've been in touch with Prime Time. They haven't responded in a timely manner. Liveline haven't responded. This needs to be out there. This, and the other thing is, the doctors are not above misrepresenting or misdiagnosing in their paperwork. So it's the doctor who stopped Eugene from being transferred from the hospital, when Chris Goody at the same time had said to his sister, oh, he's great, everything's going according to plan, he's recovering. And then the doctor said, no, he's not fit to fly. And in the discharge summary, oh, he's well and he's stable. When he couldn't stand, he passed out in the bathroom. Couldn't stand, couldn't walk, couldn't eat, doubly incontinent, and passed out in the bathroom, and had to be readmitted 2 days later with a doctor who was competent and who diagnosed nosocomial pneumonia, which is hospital-acquired pneumonia. So with that, people, Eugene is still out there. It's just to let you know, it's just to let people know. At some point I might upload videos proving everything. But at this point it's just to warn Irish people about what is going on and how you can be abandoned abroad, even though you go out under the auspices of the HSE with a recognised agent company, and you can still be left dying. Eugene was dying. I'm just hoping we get him home and that he recovers to some extent, and he is distraught. He is absolutely distraught. He gets confused, but he's conscious of what happened to him and he just cannot believe it. He's in a state of utter disbelief. And with that, I leave you. Hopefully I'll have a decent update, and at some point in time I might as well put the videos up so people can actually see what I'm saying is verifiable, objectively verifiable. So please God, prayers would be helpful. We feel like we're praying to the wrong God, Okay, people, thank you for watching. Bye bye.